1 in 4 people will be diagnosed with cancer. Disturbing for sure, but there is hope in some new treatments. We're talking about that today with Dr. Dan Aruch, a medical oncologist with Virginia Oncology Associates. So tell us more about these new treatments, Doctor.
Sure. You know, the most important thing to point out initially is trying to prevent cancer. And there are things people can do with lifestyle changes, eating healthy, exercising, trying not to smoke, which we know can be difficult for people who've been doing it for many years. In addition, you should stay out of direct sunlight and wear sunscreen. There's also some vaccines, such as the human papillomavirus, which are very important to try to prevent cervical cancer and head and neck cancer. And then, you know, if you are diagnosed with cancer, it's important to catch it early, and that's why we have screening tests like mammogram, colonoscopies. If you are a heavy smoker, even lung cancer screening with CAT scans can help detect things early, as well as pap smears. And these are things you can discuss with your primary care doctor, lifestyle changes, as well as where you can get screening tests done.
Good information to share with people to do what you can ahead of time. Let's talk about some of these new treatments, like immunotherapy.
Right. Immunotherapy is an exciting development in cancer treatment. So the idea of immunotherapy is that part of the immune system's job, in addition to fighting infection, is to try to prevent cancer. And one of the ways that cancer is able to grow is to avoid the detection of your immune system. And so one of the strategies that has been developed over the last several years, and it's really changed the landscape of cancer treatment, is these immunotherapies. And by giving these medications, which are typically an intravenous medication every few weeks, we can actually re-engage the immune system to try to fight cancer. And these are growing into many, many different types of cancer, whether it be melanoma or kidney cancer, cancers that were very difficult to treat previously. Now these immunotherapies, which are the list of which are growing, provide a lot of hope for our patients. We
were talking earlier about targeted therapies as well. Tell us more about that.
That's right. Targeted therapies are truly individualized cancer therapies. So whereas before we may say, oh, you have breast cancer, now that's not enough anymore. We can really dig deep into certain markers that could be changes either in the cancer's DNA or certain proteins that could be abnormally expressed by the cancer, and really develop a treatment plan that is specific for you. And some of these targeted therapies, which are coming out, it seems, on a weekly basis, and newer drugs provide a lot of promise for patients and don't have the typical chemotherapy side effects, and can provide patients a lot of new hope. And the developments over the last several years are just rapidly accelerating.
It's exciting news, definitely, for patients as they're trying to figure out their diagnosis. Where can people get more information?
Sure, they can go to virginiacancer.com, and we have on our website blogs as well as phone numbers for people that need more information.
All right. Dr. Dan Aruch, thank you very much.
Thank you.